All right, let's get right into it. Today, we're tackling a question that so many people with hip osteoarthritis ask themselves. Is all this exercise I'm doing actually working? For a long time, the answer has been, well, kind of fuzzy. But some brand new research is finally giving us a clear, numbers-based answer. It's turning all that uncertainty into a real, measurable goal. So let's see how they pulled it off. I want you to picture this. You've been doing your physical therapy exercises for 3 straight months. You've been diligent about it. You go back to your doctor. They ask, "So, how are you feeling?" And you say, uh, I think I'm a little better. That's the whole problem right there. It's this huge gray area for both you and your doctor. So, this is the big question, right? How do we get from that vague feeling of, I think I'm better, to the solid confidence of, I know I'm better? We need a yardstick. We need a way to know for sure that all that effort is paying off in a way that really truly matters to the person putting in the work. Now, you might be thinking, wait, don't we already have ways to measure this stuff? And yeah, we do. But here's the catch. Most of the benchmarks we use were designed for things like drug trials or surgeries. And it turns out trying to measure the slow, steady progress of exercise therapy with a tool built for the big, immediate impact of a new drug, it's like trying to measure how much it rained with a stopwatch. It's just the wrong tool for the job. And this is where it gets really interesting, because it all comes down to expectations. When you take a pill or have surgery, you're kind of expecting a big, dramatic change. That expectation alone can even juice up the placebo effect. But with exercise, we all know it's different. It's a slow burn. The benefits are earned bit by bit over time. So if you apply that big bang measurement from a drug trial to the gradual gains of exercise, you can actually make the therapy look way less effective than it really is. So, to fix this, researchers have this amazing concept called the minimal important change, or MIC for short. Now, this isn't just some random number or statistical blip. The MIC is that specific point, that threshold, where a patient can honestly say, "Yup, I feel that change is important to me." It's the real, tangible line between, "I guess I'm a little better," and, "Oh, yeah, I am definitely better." And that brings us to this fantastic new study from the University of Sydney. They set out to do one thing: find the exact MIC values just for exercise therapy in people with hip osteoarthritis. They wanted to finally build that bridge between the cold, hard data and that very human feeling of getting better. The research, which was led by Dr. Urani Guerrero, did something really smart. Instead of starting a whole new trial from scratch, they dove back into the data from a big clinical trial called Phoenix. They went looking for the clues that, it turns out, were hiding in plain sight all along. So, how did they find these magic numbers? It was actually pretty brilliant. First, they took the objective scores from about 200 patients. The standard stuff like a 10-point pain rating. But then, and this is the key move, they looked at how those exact same patients rated their own improvement on a simple scale from much worse to much better. By matching the numbers to the feelings, they could pinpoint the exact moment on the scale that lines up with the patient saying, "You know what? I actually feel better." So after all that incredible work, what did they find? What are these new benchmarks that finally define what real success looks like for someone doing exercise therapy for their hip? Let's get to the good stuff. Here's the first big one. On that familiar 0 to 10 pain scale, they found that a drop of just 2.1 points after 3 months was enough for patients to feel a real, significant difference. Think about that. If your pain started at a 6, getting down to a 4 isn't just a number changing on a chart. It's a change that you can actually feel in your day-to-day life. And hey, it's not just about pain, right? It's about what you can do. For physical function, we're talking walking, climbing stairs, just getting out of a chair. They used a 68-point scale. And on that scale, a drop of 8.7 points was the magic number after 3 months. That's not just a score, that's a real, quantifiable improvement in your ability to move through the world. Okay, so let's zoom out and look at the whole picture here. This table shows you all the key values from the study. You can see the numbers we just talked about for the 3-month mark, but what's really fascinating is how stable these numbers are when you look at the 9-month follow-up. For pain, the goal gets just a tiny bit higher, but look at function. It's incredibly consistent. This gives us a really clear data-driven roadmap for what improvement looks like over the long haul. So, look, these are great numbers for a research paper, but what do they actually mean in the real world? This is where this whole thing goes from being interesting to being truly powerful for both doctors and patients. Let's break down why this matters so much. For doctors and therapists, you now have scientifically backed targets to aim for. You can manage expectations and know what success looks like. For patients, this is huge. You get a clear goalpost. You know what you're working towards, and that can be incredibly motivating. And of course, for researchers, this gives them a much sharper, more accurate tool for designing the next wave of studies.
And you don't have to take my word for it. As the study authors themselves put it, this is about more than just reading results better. It's about creating a solid foundation, a common language that's centered on the patient, for all future research in this area. It's a real game changer.
Now, a quick reality check. The researchers are really clear that, like all good science, these findings need to be tested again. Their work was based on a specific group of people in Australia using 2 specific exercise programs. So future studies will have to see if these same numbers hold up for different people and different types of therapy. So we'll leave you with this final thought. We now have a precise, patient-focused way to measure what getting better actually feels like for hip osteoarthritis. The truly exciting question is, what's next? Just imagine applying this same kind of thinking to chronic back pain or fibromyalgia or any condition where progress is gradual and so hard to pin down. This study might not just be a new yardstick for hips, it could be a whole new way of thinking about therapy itself.